In this video, I'd like to talk about hormonal regulation of the ovaries and the menstrual cycle. So let's start by taking a look at the notes at this little flow chart that I created for us. So all I'm trying to do here is show you this premise that these two structures, the hypothalamus and the anterior pituitary, these are both structures in the brain. You remember that from AP1, that these hormones in the brain, hormones secreted by the brain, I should say, they enter into the blood, are going to circulate to the ovaries, and these hormones coming from the brain are controlling the ovaries, and then the ovaries in turn release hormones like estrogen and progesterone, and these hormones will have body-wide effects, but in particular in the menstrual cycle, what we do is we look at the effects that those hormones are having on the uterus. So looking at this chart quickly one more time, and I'm going to go on to a different chart. The hypothalamus is right above the anterior pituitary. They're anatomically connected together. We'll look at that in about 2 weeks. The hypothalamus releases many different hormones. The one that we care about today is gonadotropin-releasing hormone, or GnRH. GnRH is released by the hypothalamus, and what it does is it controls the anterior pituitary. It's going to cause the anterior pituitary to release both of these hormones, follicle-stimulating hormone, FSH, and luteinizing hormone, LH. And FSH and LH, these hormones coming from the anterior pituitary, enter the blood, circulate to the ovaries, stimulate the ovaries to undergo changes, and like I said, the ovaries will in turn secrete hormones. So let's take a look at the chart that I gave you at the end of the notes. Let's mark this up together. So this is a chart of the menstrual cycle, and you can see it's complicated because there are many different things going on, and those things that are happening are changing over time. Okay, it is a cycle though, so it is a predictable sequence of events. So on the x-axis, you see how here we're looking at days, and they're starting with day 1, and they're going out to day 27, but I'm going to squeeze day 28 in on my chart because classically the menstrual cycle is 28 days. Okay, the length of the menstrual cycle can vary, but 28 days would be, like I said, a classic length, and we'll talk about that, and we'll talk about how it can vary. So all we're looking at here basically is time going by, right? So what we're looking at on the y-axis is a number of different elements of the menstrual cycle. So we know that the brain is going to control the ovaries, and so right up at the top, they're showing us, hormones coming from the brain. And actually, they don't even show us the gonadotropin-releasing hormone, the GnRH, coming from the hypothalamus. But technically, the GnRH is what's stimulating the anterior pituitary to release LH and FSH. So what we're seeing on this first line is LH and FSH coming from the anterior pituitary. We know that those hormones are going to go to the ovary and cause changes to occur in the ovary. And hopefully when you look at this line, you recognize what's happening here. We've talked about this. This is the ovarian cycle. So here we can see ovarian follicles maturing. I can see ovulation right in the middle of this cycle, and then formation of the corpus luteum and ultimate death of the corpus luteum right into the corpus albicans. So I hope everyone recognizes this ovarian cycle. So the ovarian cycle is being driven by LH and FSH coming from the anterior pituitary. But at the same time, as the follicles mature, when ovulation occurs, when formation of the corpus luteum occurs, the ovary is also releasing hormones, and that's what they're showing us on the next line. Okay, so what we're seeing here are ovarian hormones, estrogen and progesterone. So we can see estrogen and progesterone are being released in various amounts by the ovary. And what this picture is focused in on is how estrogen and progesterone are affecting the endometrium. So remember, the endometrium is the inner lining of the uterus. Okay, so big picture, what we're looking at here, once again, and then we'll go through the details, is that the brain is releasing hormones that are affecting the ovary, and in turn the ovary releases hormones, and those hormones are affecting the endometrium. And these changes are predictable changes that occur over the course of about a 28-day period. So let's start at what's happening at the level of the brain right at the start of the menstrual cycle. So here we can see that both LH and FSH are being released. Okay, and you can see actually if we just quickly scan across, LH and FSH are always going to be secreted. Okay, so those two hormones are being released at all points during the menstrual cycle, but before ovulation, the hormone that's most important is follicle stimulating hormone, FSH, because it does exactly what the name says, follicle stimulating hormone. It's going to go to the ovary and it's going to stimulate follicles to mature so that the primordial follicle develops into the primary follicle, matures into the secondary, and then the vesicular follicle. So I'm sure you remember that story. So what FSH can do in a period of 14 days is it will cause some follicles in both ovaries to mature. It won't take a follicle from the state of primordial follicle all the way up to vesicular follicle in a period of 14 days. So in other words, FSH is working on follicles over a period of time. And so a follicle, say, that becomes a vesicular follicle in this cycle probably started months and months and months ago being stimulated by FSH. You know, it probably takes in total, 9 months to a year to get that follicle to a vesicular follicle. So the primordial follicle to primary follicle to vesicular follicle, that is occurring, but it's not exactly just one follicle that's going through like this race in 14 days. But we know that as the follicle gets bigger, what's happening is that growing follicle is secreting both estrogen and progesterone. Okay, both hormones, again, just like LH and FSH, both hormones are always present. But it's estrogen that is the star of the show before ovulation. Because do you see how estrogen levels are going way up? And that's because estrogen is being secreted by the granulosa cells. And so as you have a follicle getting bigger and bigger and bigger, and you get more and more granulosa cells, the amount of estrogen gets very high. And that estrogen causes the endometrium to proliferate. Okay, it gets thicker and thicker. So this is known as the proliferative phase of the endometrium, when the endometrium gets thicker and thicker. And so at a point when the estrogen levels, get very high, so we can see estrogen levels are peaking at a point, that is a signal to the brain. Okay, it lets the brain know that there's a mature follicle. So to have that amount of estrogen in the blood, your brain knows there's a mature follicle in the ovary. And so that's the trigger for the brain to release a big burst of LH and of FSH. So we can see this big spike of both LH and FSH at the level of the brain mid-cycle. And so it's LH now that takes the leading role. So people call this the LH surge. As you can see, there's also FSH, but it's the LH surge that causes ovulation. Okay, so I hope you can see how that works. Brain recognizes that there's a mature follicle based on the high estrogen level, releases an LH surge. LH surge is going to cause ovulation. And just prior to that, it's the LH surge that will also cause the primary oocyte to undergo the first meiotic division into the secondary oocyte and the first polar body. So that first meiotic division will occur, secondary oocyte is released, right, with the polar body clinging to it at ovulation, and it was LH that causes that to happen. Now let's take a look at our estrogen levels. What a surprise, or maybe not so much, because when that follicle ruptures, when you damage the follicle, estrogen levels drop. Okay, so we damaged that follicle. That makes sense, right? We can see estrogen is going to recover later on in the cycle, but basically those estrogen levels are going to really take a big dump. They're going to dive down to low levels, and what's going to happen at the level of the follicle is we know that follicle is going to repair itself, right, and get bigger and form the corpus luteum. And as the corpus luteum forms, look at this, progesterone levels go up. And so progesterone is the primary follicle, progesterone is the primary hormone that is coming from the corpus luteum. Okay, so the growing follicle is secreting high estrogen, but the empty follicle, the corpus luteum, secretes high progesterone. So progesterone is going to have a different effect at the level of the endometrium. So you can see the endometrium still, does get thicker, but it's just not on this, exponential, growth. Instead, what progesterone does, take a look at the glands, how they're becoming more well-developed. So that's what they're trying to show us in this picture. So we're going from a gland, that looks pretty linear to like a well-developed gland, and not only, structurally, but functionally, these glands will start secreting. And that's going to help with implantation. The other thing that we want to notice here as far as an effect of progesterone is the blood supply. So we see like little blood vessels coming up through the lamina propria during the proliferative phase. But what they're trying to show us with all of this vascular, supply is that the blood vessels are becoming very well developed. It's becoming very vascular, very glandular. And so the quality of the endometrium is becoming very good under the effects of progesterone. And this is known as the secretory phase of the uterus because the glands become secretory. And so what I would think of is under the effects of progesterone, the quality of the endometrium goes way up. The blood supply, the secretory nature, and so it's preparing for implantation. But here's the end of the story. What we can't really see in this picture, we can see the effects of progesterone, the positive effects that it's having on the endometrium, but we can't see that progesterone is also turning LH and FSH off. Okay, so as progesterone levels get higher and higher, endometrium gets richer, like we're saying, but LH and FSH levels start to go down. And when LH goes down, corpus luteum goes down. And when the corpus luteum goes down, LH levels are taking a dive now. So LH levels, progesterone levels go down. So LH levels go down, that causes death of the corpus luteum, and that's going to cause the progesterone levels to go down because the progesterone is coming from the corpus luteum. And when the progesterone levels go down, you can't maintain the endometrium, and so the endometrium dies off. And as the endometrium dies off, it will actually detach, the stratum functionalis will detach from the stratum basalis and get shed from the uterus as menstrual flow. And so by definition, the first day of menstrual flow is day 1 of the cycle. So what they're showing us at the end of the cycle, of course, would be the start of the next cycle. So day 1 is menstrual flow. And at this point in time, because the corpus luteum has died, there's no more inhibition on LH and FSH. So what happens is LH and FSH come back in higher amounts. FSH is going to cause maturation of a follicle. That growing follicle is going to secrete higher and higher levels of estrogen, which is going to cause regrowth of the endometrium. Once we have a mature follicle, it secretes a lot of estrogen. That's going to cause the brain to release a big burst of LH. That LH surge will cause ovulation, will cause the estrogen level to drop, but LH is going to cause formation of the corpus luteum. And progesterone is going to be secreted in high levels from the corpus luteum. Progesterone is going to cause the endometrium to become very rich, vascular, glandular, but these high progesterone levels are also going to inhibit LH and FSH. And particularly when we inhibit LH, the corpus luteum starts to die. And when the corpus luteum starts to die, progesterone levels go down, endometrium will start to die, and again, you're back to the start of this cycle. So let me show you what I did in the notes. In the notes, what I did is I wrote out the effects of estrogen the more body-wide effects, because it has a lot of effects on oogenesis and the uterus. But overall, estrogen has a lot of receptors body-wide, causing secondary sex characteristics, increased vascularization of the skin, just as some examples, increased adipose deposition underneath the skin, breast growth. So progesterone is more, contained to the uterus compared to body-wide. But what I did in the notes is I tried to tell the story again step by step by just writing it out. So hypothalamus secretes GnRH. That's going to cause secretion of LH and FSH from the anterior pituitary. FSH is at the start of the cycle. It's going to cause a bunch of follicles to mature. One usually outgrows the others. You can have two mature to vesicular follicle and both be ovulated, and that would, if they were both fertilized, that would be fraternal twins coming from two different oocytes. Another reason that a person could have many oocytes would be fertility drugs. Taking some type of medication that's going to stimulate the ovaries to produce more than one vesicular follicle. But typically, in a typical physiology, one outgrows the others. So the granulosa cells are going to secrete estrogen and progesterone. Sorry about the typo there, mainly estrogen and progesterone. So estrogen is going to cause the endometrium to proliferate, to grow thicker. And estrogen is also being detected by the brain. So once you have this high estrogen level that tells the brain that there's a mature follicle, that's what causes this LH surge. LH surge is going to cause completion of that first somatic division, and it's going to cause ovulation, and it's going to cause the granulosa cells to form the corpus luteum. Corpus luteum is going to get bigger under the effects of LH, and the corpus luteum is going to secrete more and more progesterone. And what progesterone is doing is it's causing the secretory phase of the uterus, the rich blood supply, glands start working, but it also inhibits LH and FSH. So once you inhibit that, those low LH levels are what are going to cause the corpus luteum to die. Progesterone levels will naturally go down. Stratum functionalis can no longer be maintained, dies, and is shed. So that is my written description. So I hope that helps. And so the stages that the uterus goes through, that's known as the uterine cycle. So there is a uterine cycle, just as there was an ovarian cycle. And I'm going to skip to some pictures just to go through that. So I have some slides pulled up. This is a picture from our book that goes through the cycle in a different way, like a more graphic picture where they're showing us GnRH triggers the anterior pituitary to release LH and FSH. FSH causes the follicle to get bigger, and granulosa cells start secreting estrogen. And those estrogen levels get higher and higher, and that estrogen output is going to trigger the LH surge, causes ovulation, and LH is going to cause formation of the corpus luteum, and that's corpus luteum is going to secrete high progesterone levels, which is going to have an inhibitory role at the level of the brain. They show us the levels of LH and FSH over the course of the cycle. The main thing to see here really is that they're both always being secreted, and that mid-cycle, it's LH that's going to cause ovulation on day 14. This is a bit of a review. I talked about this in the last video, but the ovarian cycle is when the primary follicle grows into the secondary follicle, into the vesicular follicle, ovulation, right? So this is the follicular phase, ovulation, and then the luteal phase is formation of the corpus luteum and ultimate death of the corpus luteum. So when the follicle grows bigger, you have a lot of estrogen. But when it ruptures, that is going to cause estrogen levels to drop. Corpus luteum is going to secrete more progesterone. And so we can see that here, that estrogen levels are going to go up. Once ovulation occurs, they drop, but with formation of the corpus luteum, progesterone levels go up. Here's a picture of the uterine cycle. So as I said, by definition, the first day of menstrual flow is going to be day 1. So the menstrual phase is going to be the first few days of the cycle, but when that stops, there's high estrogen levels because of the FSH coming from the anterior pituitary causing the proliferative phase, And then the secretory phase is primarily under the influence of progesterone coming from the ovaries. There's also a picture in our book that puts those two phases together. So the ovarian cycle, the follicular phase, that is when, at first there's very low estrogen levels and progesterone levels, and the endometrium is shed, and then endometrium is built up under the estrogen coming from the growing follicle, and then the proliferative phase, secretory phase of the uterus is coordinated with the luteal phase of the ovary. Okay, all the progesterone coming from the corpus luteum, causing the uterus to become ready for implantation. So I hope those images help, and I'm just going to quickly go back to the notes to give you some terms, basically. So menarche is the first menstrual cycle, and that occurs, believe it or not, years after GnRH levels start increasing. So the GnRH is going to slowly go up, and then at a point when it's high enough, the menstrual cycle will start. And once the menstrual cycle starts, it will continue on this cycle until the follicles stop responding to FSH. So keep in mind, all of these follicles in the ovary, they started undergoing meiosis during fetal development of that person. And so the follicles become non-responsive. And so at the point in time when FSH is being secreted by the brain and no follicles respond, that's basically what menopause is. Menopause means that even though the brain is releasing FSH, no follicles are responding. And if no follicles respond, if no follicles are growing, estrogen levels are going to stay low, progesterone levels stay low, and the endometrium does not get built up. So one thing to consider here is, during menopause, what are FSH levels like? And I'm going to leave that as a question for you to think about. What would FSH levels be like if the ovary doesn't have any follicles that are responding to FSH? So maybe you can come up with an answer for that and throw it in the Unit 1 questions, what you think of that. So I'll see you again soon, talk about human development. Thank you.